Hello, hello. We are on the second.
Okay, and then just some
chapter
common
18.
concerns during.
We are on chapter 18, the second video. It is the common concerns during newborn transition.
This newborn transition. These are kind of just three common things that can happen to the baby. The first one is transient tachypnea of the newborn. This is a mild respiratory distress in the neonate. It's accompanied by retractions. Remember that sucking in of this chest wall, nasal flaring, expiratory grunting, and or cyanosis. So this will require some low-dose oxygen therapy. It will happen shortly after delivery in term babies. It's really time limited. It's typically very short, less than 24 hours, and typically kind of self-limiting. It takes care of itself on its own. The oxygen is kind of more for support. The baby will probably spend an observational time in the NICU. If an x-ray is done on the baby, a lot of times the lungs will look like ground glass. This is caused by a delay in clearing the fluid from the fetal lungs after birth, because the lungs are filled with fluid, and that leads to an ineffective gas exchange, respiratory distress, and tachypnea. Physiological jaundice. This is hyperbilirubinemia. Physiological jaundice is the visible manifestation of hyperbilirubinemia. It requires phototherapy, which are just those blue lights, those ultraviolet lights, and that helps break down the bilirubin. This is really common in preterm babies because they have an immature liver. We will assess our babies we'll assess their jaundice level. We will assess their bilirubin level every day that they're in the hospital. So we'll do it every shift actually, and just chart it, document it on this chart that we have to see if the levels are too high. If the levels start to be too high, first we're going to encourage more feeding. If mom's breastfeeding, we might encourage her to start bottle feeding for a couple feedings, not all of her feedings, but just to get more fluids into the baby to help excrete that through the stool, that bilirubin. We'll encourage sunlight, make sure the baby's near the window and getting sunlight in, because that will help break down the bilirubin. And then if it gets to be the levels are too high, that it's not responding to those interventions, then that's when we have to do the Billy lights. And sometimes patients are discharged home with Billy lights, or sometimes they have to get admitted to the NICU, just depending on how high the bilirubin levels are. But remember, we don't want a lot of accumulation of bilirubin because it can cause brain damage or seizures. And then hypoglycemia, this is really common too. They have that big drop in blood sugar after the placenta has been cut off. They've been cut off from the placenta supply. They're no longer receiving mom's glucose. And then depending on how much they're eating, and that first few hours will kind of depend on their sugar levels. If their sugar levels are high, again, we'll encourage eating. Worst case scenario, we do have to give some kind of D5 IV fluids to them. But symptoms of hypoglycemia would be a jitteriness, low body temperature. They can't get their temperature back up to 97.7 or higher. There's irritability, and there's respiratory distress. So those are kind of some of the things that we look for. This is just really this kind of, the transient tachypnea, their interventions would be provide oxygen, ensure warmth, and then we're just doing regular respiratory assessments and checking for that. And then let's talk real quick about the selected screening for newborns. So this is typically called newborn screening. You might hear it being called PKU. This is when we get blood samples from the baby's heel. So we puncture the baby's heel, and we collect these 4 circles of blood, and then we send them off to get tested. So these tests in Nevada, this test for 60 different metabolic tests. So these are kind of tests that problems that would not be caught or easily recognized at birth without proper testing. But if they're left untreated, some of the disorders can cause intellectual disabilities or even death. So a newborn screening helps us detect these issues right after birth. Every state has a different test that they test for. But Nevada has 31 core tests and 29 secondary tests. So we test for 60 different metabolic tests here in Nevada.
60.
So we do this hill stick. There's actually 5 circles now that we fill up with blood, and then we send this off to a lab. Either there's one in Reno or in Oregon. We send them to the lab. The lab will test them, and then they'll call the doctor's office, and they call the mom directly if there's a problem, so we can start treatment right away. We will do this typically at 24 hours of life, and then we also repeat it again at 2 weeks of life, typically in the doctor's office, or the patient can come back to the hospital, but it does need to be repeated at 2 weeks of life. The things that it will test for would be this PKU. That's just a metabolic disorder. It tests for congenital hypothyroidism. It's when a newborn is born with an underactive thyroid gland, so they can't produce thyroid hormone. My nephew was actually diagnosed with this off of the newborn screening, so life-saving, right? It would cause severe brain damage if not treated in the first few weeks of life. So definitely saved him. Galactosemia, this is a rare genetic metabolic disorder where babies are born without the ability to convert milk sugar into glucose. So that's something that they need to help them live. And then sickle cell anemia is an inherited group of disorders where red blood cells contort into a sickle shape. The cells die early, leaving a shortage of healthy red blood cells that can block blood flow. And it's super painful when they're in crisis.
Oh, we're all done? Okay. All right, so let's go on to the next video.